If this hospital failed, it would be a disaster, both a humanitarian disaster and a medical business disaster for the whole Silicon Valley.
Well, hi everyone. I'm Michael Elliott, and very pleased today to welcome a longtime supporter and champion of Valley Health Foundation, Dick Levy. Dick, welcome. Thank you for being with us today.
Thanks for having me.
Dick, you are a noted philanthropist. You are the former CEO of Varian Medical Systems, and you've been a supporter of VHF since 2008. And there's a story I wanted to tell about a gift that you made last September, and I want to read the email that you sent me because it's an email that means a lot to me personally. And just for context for our viewers, I had sent out a mass appeal in the context of the work of our last fall, which was the crisis from the federal government, these historic cuts to Medicaid. And I invited all of our supporters to a fundraising event that we were organizing. And you wrote me this. You said, "Michael, I cannot attend your fundraiser next weekend, but I want to help. See attach. You've got a tough fight ahead of you, but you will succeed." It was a lovely message of encouragement. And the message below told me that you, through the Silicon Valley Community Foundation, were making a $2 million donation to Valley Health Foundation. The emotion that I remember at that moment the most is one of hope. That in this very difficult moment, that there are people out there willing to step up big. What inspired that gift?
Several things. I got to know Valley Medical, must have been in the 80s or 90s. I was in the medical equipment business, selling linear accelerators used for cancer treatment. Very modern, expensive equipment, and it's really revolutionized the way cancer is treated. And I came to Valley Medical, and I didn't expect that Valley Medical would be interested in something that sophisticated. This is a safety net hospital, which takes care of everybody. And Valley Medical bought the top of the line equipment, put together a really wonderful department for cancer treatment. And it just impressed me that here's a county hospital, which is going all out to be one of the best hospitals in the country on treating cancer. And that just tugged at my heartstrings. How can we keep this wonderful institution alive? That's really what inspired me to do something more.
It was more of more, I will say that. And it came at a time for us where we're trying to get this message out about the essential nature of our public hospitals. And I think what a lot of residents learn in this community is our public hospitals aren't just for people that don't have other options, that they provide essential trauma and emergency services that we all depend upon, our rehabilitation center, our burn services.
If Valley Medical failed, you would have a continuous effect. It would affect every other hospital in the area. It would certainly affect patients. They wouldn't be able to get the kind of coverage that they get now. But it would affect the whole business environment in the Valley.
You could see other private hospitals potentially be
they'd be in trouble.
Very big trouble.
Or companies would be in trouble. Companies that buy insurance for their employees or have self-insured employee programs. The cost for people who aren't on Medicare and Medicaid would go up much faster to take advantage of, to take account of the fact that hospitals were losing so much money on the Medicare and Medicaid. When you think about healthcare is a big part of the economy. In the United States, healthcare is 18% of the gross domestic product, second biggest industry in the country after defense industry. When something goes wrong with a big industry like this, it affects the entire economy. So we can't afford to let Valley Medical die. Can't afford to even reduce services. People need these services.
From someone that thinks deeply about your philanthropy and supports a wide array of organizations, what's the value to a donor of investing in supporting their public hospital?
What I look for as a philanthropist is a specific program that I want to support. If it just goes into a general fund, that isn't very enticing to me. If it goes to solving a very specific problem or doing something that's really needed to keep the organization alive or to keep it healthy, whatever, that excites me. As I got older and I got wealthier, that my whole thinking about philanthropy changed. I wanted to be involved in solving real problems. And that's where I am today.
When your gift came in September, I would have bet that our chances of not succeeding in that election were greater than success. And your there were long odds for us, and both your encouragement and your investment is both reasons why we won. And as a philanthropist, you want to know on sort of the value of your return. So that $2 million investment is going to translate into $1.3 billion in public investment in healthcare services in this community for the next 5 years. So that's not a bad return. A public hospital's mission is different, that we have to run towards the problem. We can't avoid them because our mission is to be the safety net. So thank you for believing in us. I'm glad that our supporters got a chance to meet you, and with some announcements we'll have a little bit later, there'll be some more opportunities for folks to hear from you and to meet you, and we're really excited about that. So thank you very much, Dick, for being with us today.
It's my pleasure, and you make me feel real good that I can help you. You deserve it.
Thank you.